Okay, we're going to start. Thanks everyone for joining right on time. I'm Anne Livingstone. It's my pleasure to host today's session for the Community Care Smart Assistive Technology Collaborative. And today's session is Technology and Digital Inclusion for All Ages. Today's session is a virtual event in collaboration with the Good Things Foundation as part of Get Online Week. This is a really important week, a national and indeed international week to help everyone get online and get connected by a number of free community events around the countryside that sees thousands of local events taking place hosted by a range of community service organisations like our Community Care Smart Assistive Technology. It's really giving everyone a chance to find the support that they need to improve their digital skills and get motivated to learn more and get connected. But before we start this morning, I'm going to do some housekeeping. Just in the interests of the recording and the smooth running of today's session, all your microphones have been muted, but you do have the chance to ask questions, and these can be posted from right from the very start now. Through the presentations and post those questions in the Q&A panel. We hope that there won't be any technical issues during the webinar, but if you do, we've got a technical team of Georgie and Cody in the background here to help you out with any concerns that you might have. Again, just post those in the Q&A panel and the technical team will directly contact with you. This session is being recorded for those who aren't able to join us today and will be made available in the coming days via the Community Care Smart Assistive Technology Collaborative. We've got two speakers today, two eminent speakers, so I thank them both for joining us. So let me first introduce our first speaker, Associate Professor Anthony McCosker from Swinburne University. I'll finalise the day with a wrap up and answer the questions that have been posed during the session and a discussion about the opportunities to improve digital literacy and what that means actually for improved quality in aged and community care settings. So it's my pleasure to welcome you, Anthony, to today's session. It's great to have you on board. We note that you're an Associate Professor of Media and Communications at Swinburne University of Technology, based in Melbourne. So we appreciate that you've gone through that long stretch of lockdown. Anthony is Deputy Director of Swinburne's Social Innovation Research Institute and is the Chief Investigatory for the Australian Research Council Centre of Excellence for Automated Decision-Making and Society. He researches the uses and the impact of new communication technologies, particularly with a focus on digital and social inclusion, which is highly important to today's session. He's also led the national evaluation of the Be Connected program. Welcome, Anthony, and just remind people as they come on board to post any Q&As for Anthony as he presents. Welcome on board. Over to you, Anthony.
Thank you very much, Anne. It's really great to have this opportunity to speak, and it's fantastic that we have a Get Online Week each year because it's a really good, important reminder that at least 11% of our entire population are disconnected from the kind of information services and interactions that we often take for granted in our use of digital technologies. So I'm going to talk about the national infrastructure that's been put in place with the aim of getting more older Australians online and building digital skills and digital literacy. And this is particularly around the role of Be Connected, the national program that has been put in place by Department of Social Services and managed by the Good Things Foundation and in collaboration with eSafety Commissioner. Now, I'd just like to acknowledge the team that I worked with in our 4-year evaluation of Be Connected, and I'm going to talk right through the evaluation and the impact and what we've learnt about getting people online and the difficulties and the problems and the challenges and issues. But I'd particularly like to acknowledge Roxolana Suhaverska and Julie Tucker, who were project managers for this project, and my collaborators, Christine Critchley, who unfortunately is no longer with us and passed away just before the end of the project, Jared Walsh, Kiros Hirui, and Michelle Lim and Joe Barraquette. A fairly large team with a lot of great interdisciplinary skills. So just to kind of set the scene, I think we're all somewhat aware of the big picture issues. The older Australians are the least digitally included, and we continue to refer to the Australian Digital Inclusion Index, which is also a partnership between Swinburne University, RMIT, and Telstra, where we are charting levels of digital inclusion across Australia in a unique way around the world. And it's amazing that we can continue to do this work. The Digital Inclusion Index for 2020 and 2021 was launched last week, so you can find out more about the most up-to-date scores. But we continually see that older Australians are the least digitally included. And we also see that people with disability on average 10 points below the average ADII scores for the Australian population. Only 55% of Australians aged 65 and over regularly access the internet. And in a situation, in a scenario that we've really come to understand, or are beginning to understand quite well over the last 2 years, of digital by default services, where services are shutting their front doors, and that was contributed to, or that was fast-paced by COVID and by the restrictions brought about by the pandemic. But it's been happening for some time in terms of government services, in terms of a whole range of community services and social services and health services that mean that that individuals have to go online first in order to make that connection with the service. And the importance of that cannot be underestimated when we're looking at 11% of the nation being relatively disconnected from digital technologies. So this evaluation was a really unique opportunity for us. The federal government doesn't often invest as much as it did in evaluation of its programs. And it gave us an opportunity to understand, what does it take to improve digital skills, literacy, and participation? Who benefits from a program like this, and in what ways? And how does this program, or how does Be Connected, in terms of its network, contribute to digital skills, literacy, and participation across the country? These are really important questions. They're very difficult to answer, and I'm particularly continuing my research to be focused on digital skills and literacies, particularly as digital technologies continue to develop at pace. And my current work is really looking at issues around automation, around increasing use of data and data analytics in all sorts of organizations and contexts, which I'll come back to. But just in case you're not totally familiar with the intervention that was Be Connected. Be Connected's a number of things, really. It's a set of web resources, essentially, that were developed by the e-Safety Commissioner, and a huge investment in really good foundational digital skills resources that can be found through the Be Connected website. There's a whole range of topics, of activities, of tutorials that continue to be invested in and expanded They continue to respond to things like the need to, for example, develop skills needed to download COVID-safe app and check-in technology and so on. These skills, this infrastructure is a really important foundation, but it's only part of what Be Connected is. Be Connected is also local help. It's also a network, an extensive network of partners, partner organizations that really expand the points of contact with digital inclusion support. And I'll come back to that as a really important part of what is successful about Be Connected, and how and why it's really a community-wide process and set of practices that are involved. One of the key things that I want to emphasize here, though, is that this is an expansion of digital inclusion support beyond libraries and adult education into organizations like U3A, men's sheds, country women's associations, bowls clubs, but also into the retirement sector and aged care sector as well, which is really important development, particularly for reaching older Australians. Now, I don't want to bore you too much with our evaluation methods and the academic side of things, but I just wanted to note that what we were looking at in the program were aspects of its appropriateness, the appropriateness of the design of the program and how it functions and how it operates. But we were particularly looking at the effectiveness of the program, which I'll explore in a little bit of detail. And we're also looking at the efficiency. So we did what's called a social return on investment analysis, trying to understand the benefits to society on an economic level, but also on a social level. So in terms of that analysis, we were looking at the development of particular digital skills, which I'm going to talk a little bit more about, but also what the benefit of digital confidence is, particularly in terms of things to do with e-safety, and also in terms of health and well-being around loneliness and social connection. So our approach considers digital skills, confidence, knowledge, and literacy, and it considers these things to be interconnected with socioeconomic and cultural contexts and resources. So factors, demographic factors, are really important to how we understand skills and digital participation. Okay, so just to set the scene a little bit, some of the drivers and barriers that we saw in our analysis to older Australians getting online and gaining independence in digital technology use are somewhat well known, but sometimes they're a little bit surprising. So there was an assumption early on from the government side that it was always going to be family members that could help older Australians get online and maintain their digital skills and technology use. And that's something that we showed in our research is absolutely not the case. It can happen, of course, but older Australians really dislike, in fact, often hate learning from family members. They often they tell us stories about being given a secondhand phone, someone pushing a whole heap of buttons on it, handing it over and saying, this is how you do it, this is what you use it for, and then walking away. And that kind of level of support or type of support we know doesn't really work. One of the other key barriers for digital inclusion that we could really detail in our work was around the issue of low digital confidence and the issue of fear around security, fear around technology failures or breaking the system that so many individuals have, which means that they can't learn as they go in that intuitive sense, and then they can't necessarily gain independence. A key on the other side of the ledger, I guess, a key driver for people wanting to improve their digital skills is around social connection. Social connection was probably the number one element, the number one driver that meant that people who didn't have a reason to connect or to use technologies, for example, through their work or their former work, social connection was the driver that meant that they were that was about connecting with their family, their friends who had moved away, and particularly their grandkids and other and younger generations. But there's also, we saw this increasing demand around connecting to services and banking and also entertainment. Now, the key thing for us, because we were dealing with 50-year-olds and up, which, let me just put it out there, isn't old. We're not lumping everyone in the older Australians category as 50 and up, but we're really looking at that transitional period, people who are either moving from one job to another in precarious employment, or are moving into retirement. And the further that people move away from retirement or don't have that kind of work experience in which technology is a part of their working life, find the most challenge in our experience. Okay, so just to get some key findings up front, how effective is the program? Has Be Connected improved the digital skills, confidence, economic and social participation and social connectedness of participants? Yes, it has in a lot of ways. And so the short answer is yes, but there's a much longer answer, of course, and it's all about the nuance of who the program works for, in what ways, and how can we enhance the elements that really work and work strongly and work well in the broadest kind of contexts. So I'm going to start paring that back a little bit and explain what it takes to build digital skills and to develop digital skills, and where we see what kinds of change taking place. So first of all, Be Connected has engaged, well, at the time of our research, it had engaged more than 500,000 learners directly supporting, so through ongoing programs, directly supporting more than 130,000 users, learners. But the engagement now is up over 1 million, and the number of directly supported learners is greatly increased as well. It's really pushed the targets that the government set for it. And I think that's because of the interest in the community and the importance of the issues. This is not something that will go away. And in some cases, in some senses, in some policy senses, there's this perception that as we age, as our generations kind of age with technology, these issues of digital inclusion will disappear. I will say up front from all of our research that is not the case, especially as new technologies come on board and people move away from their use through workplaces in particular. So we saw significant improvement in 7 out of 12 key operational skill areas. And I'm going to explain what that means and how we distinguish between operational skills and strategic skills when we're talking about digital skills. But we also saw significantly more confidence in using smartphones, tablets, email and search engines independently. And we see these as the baseline key skills that mean that participants and learners can build on that and build on it in their own way in terms of what their particular personal needs are. We also saw significantly more confidence in being safe online, and that was a key, that has always been a key KPI of the program, particularly because of the level of fraud and and loss of financial financial resources on the basis of poor digital practices. We also saw, interestingly, we saw increased social connectedness and a statistically significant reduction in loneliness through participation in the program. And that's something that I'm really interested in for a wide range of reasons, but particularly because of what it says about the embeddedness of digital technologies and digital skills in the way that we connect socially today. In terms of the model itself, we've said that the model, the networked model, the network partnership model of Be Connected is one of its most successful elements. So this is about establishing a kind of community infrastructure for digital inclusion across Australia. And you can see this is a map made 2 years ago of network partners right across Australia, including in remote and rural parts of Australia where there's low population. The model itself empowers diverse partner organisations to reach older Australians in their communities. That's the key thing for us. And it affects that issue and addresses that issue of not knowing where to go to get help. So if the local bowls club is talking about getting people online and you happen to be there because you like bowls, then that makes that connection real, and it makes action happen after that point. So what this also does, I'd have to say, is build trust. So rather than a program that's imposed by government, by stale kiosks that people don't want to have anything to do with, it's really about building trust in connecting with the program and connecting with others as well. So what we found was that 72% of participants travelled less than 15 minutes to a network partner venue, which is really remarkable, particularly when you're taking into account the regional and rural populations where travel is just part of life. We also saw that nearly half of participants were visiting a network partner at least once a week, which is really interesting, and that speaks to that importance of social connection in the process as well. Okay, so in terms of social and economic outcomes, it's really interesting to think about what people use technology for and how we can actually leverage people's own preferences for using technology and needs for using technology to build skills more generally, and build those kind of skills that mean that they will be able to access the services that they need, find the information that they need, be able to navigate and negotiate digital environments and technologies. So we looked at social, economic, personal, and cultural uses of technology. And what we found is that those areas of participation or use of technology didn't really change that much in a statistical sense through engagement with Be Connected, other than around leisure and games and health and lifestyle uses. Now, I don't want to put too much stock in this one way or the other, but I wanted to highlight it a little bit, because we often think that the way to get people online is to jump in and make sure that they can use MyGov, make sure that they can do online banking, make sure that they can, visit government websites and so on. It's not necessarily what people want to do, and it's not necessarily the best way to build skills. So a lot of the partner organizations that we speak to talk about the way that they use games, for example, and it might be Words with Friends, something like that you could use on a mobile phone fairly simply, but you have to actually know how to navigate the phone, navigate apps, consider data use, and then engage with other people in a way that's safe and effective. And so we're increasingly interested in the way that those kind of mechanisms can be used in building digital skills and independence. We did find that 66% used internet banking already, accessed online video, and 65% had a MyGov account. But that still leaves a huge percentage of program participants who don't do these things. And if we consider that the program participants are those who are actually making an effort to get online or to build their skills, this says something about the larger population and the importance of those skills needed to navigate a MyGov account, for example. The important thing for us was that we did see a statistical difference in that sense of independence. So learners use the internet more often at home with a network partner and on their mobile devices away from home. And that independence was a really important part of the change that we were looking for. Now, just coming back to digital confidence, it's one of in terms of all of the research where we look at digital skills development, digital inclusion and participation, and the barriers associated with those things. We often come back to this idea or an issue of digital confidence. It's actually, in our research, it's actually a really complicated issue. For instance, we found that there were 16% that we could clearly say, or who clearly specified that they were not confident with digital technologies at all. And that's a fairly significant percentage. We found, though, that there was also a massive group that only had some confidence, really limited confidence. And it's in that red part of the pie chart there that I'm actually most interested in, because there's such a wide range of needs in that space that go unmet and issues that arise from that lack of confidence. But we also found this percentage of participants that were confident, 37%. And you'd think, well, why are they participating in a digital skills program? And it's really interesting because we found a significant group of participants in the program who were confident and were active digital technology users, and some of them were engaging in the program more for their own kind of continued lifelong learning than specific need. So they had the skills, they had the ability, but they just really wanted to push it further and see what else they could do and keep up with technology. They kept mentioning keeping up with change and technology, and that's something that drove them to be part of the program. Now, ordinarily, the Department of Social Services would look at this and think, okay, they probably shouldn't be part of the program. We should be focusing on the low confidence and minimal confidence cohorts. But for us, we saw the huge importance of that group. They often became, through one mechanism or another, digital mentors within the program. And they were also really important in terms of bridging that or brokering that peer learning work that network partners found really important. But we can also see here that we have 18%, for example, of 80-plus-year-olds in the no confidence slot, but we also have 22% of 80-plus-year-olds in the confidence spot. So when we look at those really broad indicators around 65-plus-year-olds being not online, or 85-plus-year-olds being absolutely the least connected, we have to look at and understand difference within those cohorts as well. And that's something that in my research I'm really focused on at the moment. What that variation is and how do we account for that variation in 50-plus-year-olds in terms of digital connection. Now, I just wanted to dig in a little bit on digital skills as well, and what we mean by digital skills. And it's actually something that is quite contentious in terms of how we measure digital skills. It's quite difficult to do. It's really difficult to do because, you know, if you were to choose which things that you do with digital technologies that are most important, it will be really hard to put your finger on something in particular. The international research has looked at this for quite a long time, for the last 20 years, in fact, you know, possibly longer. And in our research, we kind of aligned with some of the leading edge work that's being done in this space that tries to avoid thinking about digital skills as a kind of hierarchy of low to high or basic to advanced, which we often get in a lot of simple measures of digital skills. We really tried to focus on a group of skills that we see as operational skills. And you could think of them as foundational, but at the same time, we don't want to lower their importance in the scale or in the scheme of different kinds of digital skills. But these are all the kind of skills that you know, a regular internet user or digital device user will take for granted and will be able to do intuitively. You know, it'll be installing apps, it'll be keeping track of mobile costs and data, it'll be opening browser tabs, bookmarking things, saving files, downloading files, those kind of skills. Now, we do see them as foundational in the sense that they do enable other skills, and we think of those other skills as strategic skills. And strategic skills could be about information navigation. It could be about creative skills, about creating content, using technology and software in interesting ways, or using it for work or for different kinds of applications, and also about social and communication skills. Now, all of these strategic skills, I have to emphasize, are kind of somewhere between technical and other things, just competencies in life. You know, we can't necessarily create content on digital platforms if we don't have those kind of creative skills in offline space as well. And similarly with social and communication skills, there's an important part of that that is not about technology as well. In terms of improvement, we saw most improvement around those operational skills. So we saw improvement for 7 types of skills, but really particularly, really strong change for all participants around 4 key skills. That was installing mobile apps, bookmarking websites, mobile app use cost, and use of shortcuts, interestingly, which was about those specific skills needed for operating keyboards, for example. We also saw that connection between completing modules. So the online resources were useful in developing those skills. And we saw some strategic skills change in terms of managing digital content and creating new content, and understanding licenses and IP and privacy issues as well, which was really important. Now, I wanted to come back to this idea of who the program works for, and that issue of variation and difference, and how we account for different kinds of engagement with digital technologies and different levels of digital skills and inclusion in that 50-plus-year-old age group. And this is something that hasn't really been well understood globally in terms of the research. In our research, we saw 3 key groups, and this comes from some really quite sophisticated statistical modeling, looking at the way people engage with digital technologies, but also the demographic factors, their attitudes to digital technologies, and the outcomes of the program as well, or the outcomes of their learning. So in terms of the emerging, we call them emerging, accomplished, and evolving, and we have accomplished in the middle because we don't want to see this again as a progression, because these are just different groups with different needs and competencies and interests as well, and backgrounds, importantly. So we saw a group that had low initial engagement, but also saw global change. So they completed less modules. They didn't do as much with the online tools, but they engaged with the program in other ways, often through working with digital mentors. They were more demographically, they were more likely to be women. They were more likely to be older. They had lower English reading skills. So literacy in general was connected with digital literacy, which is really interesting. And importantly, they had non-professional work backgrounds. And this is something that we saw, that kind of life trajectory and exposure and use of technology throughout the life course being really important to the trajectory of digital inclusion and exclusion. The accomplished group, as I mentioned, were highly engaged already. They loved doing the modules. They just flicked through them. They did all of the modules that they could. They were more likely to be men, more likely to be younger, have higher English reading skills. And importantly, with a professional work background, we spoke to some who talked about early computers and early computer programming language and just loving it and being involved, as I mentioned. But we also saw this, what we call evolving group. And to me, these are the most important. This is the group that had sometimes a professional, sometimes a non-professional work background, that had exposure to digital technologies. If you were to do a general survey around digital connectedness, they would come up as connected. They would come up as using a laptop, using tablets, using phones, etc. They could complete modules. However, they had very low digital confidence. They tended to be women, more likely to be women, but a mix. Were younger, had higher English reading skills, and as I said, non-professional, sometimes professional work background. Now, it's that group that I think we need to understand more and understand their needs. They were often targeted in terms of the change and the learning and what it was that they needed to and wanted to learn through the program. And I think a large part of that was a cohort that were involved in the program who were late in their late working life, and they were moving between jobs, trying to get new jobs, but having to navigate and negotiate online work and job search systems, services, and all of those kind of things as well. Okay, so in terms of the effectiveness of the program, I did want to come back to this because we did see we were absolutely able to show the social value that's been created out of this investment. The investment in the program is, in the scheme of things, a drop in the ocean for the federal government. It was a $47 million investment over 4 years initially, and that was extended just recently for the next 3 years. Now, that investment we see is creating $4 for every $1 in social value. And we calculate that in terms of the learning, the volunteer time and labor and effort, the well-being and social connection, the potential job skills development and opportunities that were unlocked through the program. So we saw these things. We saw local individualized support and mentoring, trust building being really important, particularly through the work of the digital mentors. I should mention that there was a small army of digital mentors that have been brought on board, either in paid roles or in voluntary roles, 15,000 now across the country, working to help others, often older people themselves, but people who are trusted and are deemed the go-to people for support for the cohort. We also saw the individual needs and interests really shaping those learning skills and learning outcomes. And we saw that online safety helps as a baseline to unlock skills development and confidence and participation. So we do see that online safety is really important as part of the process. We saw operational skills providing foundations, but also learners needing those strategic skills and looking for them in terms of what they want. Learning resources and activities work well but only when they cater to all levels of ability, I think. So we did see that proportion of disconnected and low engagement participants who actually didn't make a lot of use of the online resources at all themselves. So just finally, and I want to kind of wrap it up by building this outwards a little bit. The findings of this work, we're still working through the findings and publishing our research in different academic journals and public journals, and we continue to inform the Be Connected network and to feed back into the Be Connected network. But some of the other work that we're doing at the moment is looking sort of outwards and looking at those new technologies and the way that they are transforming, particularly the not-for-profit sector and community sector. So as part of the Centre of Excellence for Automated Decision-Making in Society, which is a mouthful, I'm working on a project at the moment that is about building data and digital capacity in the not-for-profit sector. And we're working with a wide range of organisations and trying to understand the way that digital transformation is happening, the way that data is being used and is feeding into decision-making in organisations, and the kind of capability building that's needed in the workforce. And I know that this is the topic of the next presentation as well. But so I just wanted to place this digital inclusion work in this context. And we've undertaken some similar projects in the last year or so, working with organisations like the Lord Mayor's Charitable Fund in Melbourne. What we're trying to do is develop this sense of collaboration, benchmarking in integrated systems, knowledge sharing and skills development across organisations so that they can help their workforce develop skills from the ground up, particularly as a response to the burgeoning new technologies and digital transformation and increasingly automation of all workplaces, which is really important. Look, I might leave it there and hand back to you, Anne. And yeah, welcome to ask questions, and I'm happy to discuss at any point.
Thanks, Anthony. Fantastic, diverse presentation, really relevant to community sector, who I guess in the main are dealing with some of the most digitally challenged consumers and individuals accessing their services, but importantly also workforces. Anthony, we're going to take questions at the end of Claire's presentation. Our board has been inundated with questions both on our Community Care Assistive Technology Collaborative site and on the panel. So just remind everyone to pose their questions now, and we'll try to get to as many of them by the end of the presentation. Thanks, Anthony. It's now my pleasure to introduce our second speaker of the day. Dr. Claire Mason is going to be delivering remotely, so she will not be able to join us for question time, but she is going to take every question and respond to people if they're not able to be responded by Anthony or myself at the end of today's session. So again, a reminder, post questions in the Q&A panel. If you've got any technical issues, have a chat to Georgie or Cody in the chat pane. By way of introduction, Dr. Claire Mason is an applied researcher with CSIRO Data 61. In this role, she supports agility and resilience in the Australian workforce by capturing novel sources of data about changing labour market, and particularly the data that would inform choices of job seekers educators and employment service providers. More generally, her research explores the opportunities and challenges associated with our increased reliance on digital technology across a range of contexts, in our homes and businesses, in our jobs, in vocational training and education, and in regions and in later life. She also explores how social and organisation as well as institutional factors influence data practices, and in turn our opportunities for data-driven innovation. It's my great pleasure to introduce and welcome Dr. Claire Mason.
Good morning, and thank you for your time today. It's a pleasure to share with you some of the work that we've been doing, talking about the way in which technology and other factors are affecting skills trends, the types of skills that workers need to have to remain employable in the contemporary labour market. So I'll just quickly cover some earlier research that we did, which is described in our report, Tomorrow's Digitally Enabled Workforce. Basically, this draws out the fact that a confluence of forces, all the factors mentioned on this slide here, have been having an impact on labour markets. And because there's so many of these forces which are creating change, we're seeing a faster rate of change in the types of skills that are needed to perform a given role than we have seen previously in our labour market. And some of the most important of these are things like the demographic shifts. So with an ageing population, we're seeing much more demand for healthcare and aged care, and also mental health support, because not only are we an ageing population, but we are a richer population and experiencing higher rates of chronic conditions such as mental health problems and obesity. But another thing that's happening is that workers in developing economies are becoming more highly skilled. So we're seeing an increasing level of competition for the mid-skilled and high-skilled work. But perhaps the most important of them all is the rapid developments in technology, which are not only changing faster and faster in terms of new applications and new developments, but also becoming more comprehensive in the type of work that they can do. And the COVID-19 crisis has been seen to accelerate many of the trends that were drawn out. In particular, the shift to digitization of products and services. So the fact that technology allows us now to deliver work through digital channels. And with COVID-19, there was a lot of pressure to start making the most of this capability of technology. And here you can see that around the world, there's been a rapid acceleration in this trend. So what effect does technology and the digitization of work actually have on demand for workers? Well, an important study was carried out by two university researchers at Oxford University called Frey and Osborne, and they carried out interviews with leading technology developers across a range of fields, from artificial intelligence to robotics to sensors. And when they looked at the types of tasks that these technologies would be able to complete in the future, they were able to describe the level of automation risk that each occupation in the economy would have based on whether it currently performs some of the tasks that are being automated. And so what we have here is their formula mapped for the 15 largest occupations in the Australian economy, at least for female workers. And what you can see from the height of the bar is the level of automation risk. For sales assistants and salespersons, the first category in the graph, you can see that the height of the bar is 80%. And that is because, according to these experts, approximately 80% of the tasks that salespeople currently do could be automated in the future. And if you think about the number of transactions that we now do online, the presence of increasingly sophisticated vending machines and self-service checkouts, it's easy to understand why a lot of the work that used to be done by human salespeople could now be automated. The second largest occupational category in the Australian labour market for women is school teacher. And here you can see that while it's a relatively large occupational category, the automation risk is extremely low. And that is because, as a general rule, the things that can be automated are generally anything that's routine or rule-based. Because as long as you can tell a computer, if this happens, then do that, it is relatively easy to what we call codify the task. And the things that are much harder to automate are problems that haven't been seen before, for which we have no rules, or things that aren't routine and predictable. And fundamentally, the least routine and predictable thing we have are interpersonal interactions. So a task such as what school teachers do that involves a lot of working with people in a very interpersonal environment is far less vulnerable to automation than something like accounting, which does follow very clearly prescribed rules. So one of the key messages is that increased reliance on technology has high impacts for some occupations and much lower impacts for the occupations where a lot of interpersonal interaction is fundamental to the job, and if the job can't be done without that contact with human beings. Another one is that even within a given occupation, the impacts can vary a lot, and that is because what Frey and Osborne have shown us is the potential of the technology. And whether or not that technology potential is actually realized depends a lot on our social choices. So for example, truck drivers, from one perspective, their role is highly automatable, and that's why we already have self-driving trucks out in mine sites where there are relatively few people, and the use of automated trucks can actually decrease the risk to human beings. But in highly built up urban areas, the risk of a self-driving car or truck that might somehow not behave according to the rules is judged to be much higher for human beings, and therefore we've chosen not to deploy that technology up until this point. So it's very hard to make predictions about exactly how the impacts of technology will play out. But as you can see, when it comes to personal carers and assistants, there is, despite the fact that it is quite an interpersonal role, a moderately high risk of automation. And I'm guessing that some of that is due to the fact that in the future we'll be able to use artificial intelligence to better predict when a particular type of support is needed, and thereby be more efficient in our allocation of people's time. And of course, there will be a greater potential to deliver services remotely through the use of video conferencing channels or through using smart devices in smart homes to keep people safe without a human being necessarily having to be on site. But for all waves of technology that development that we've seen in history, there've been more new jobs created than jobs have been taken away. So we expect that this time, like all previous times, we will still see high demand, if not growing demand for workers, even as more and more of the current work is being automated. And that is because new technologies allow us to do new services, to evaluate in new ways, to deliver new things, and usually there's high demand for that new capability. And consistent with this view, the National Skills Commission has done some early work to begin exploring the nature of the new occupations that are emerging as a result of these technology developments. So they've come up with these different categories of new occupations that are commonly advertised today and yet aren't yet represented in the standard occupational taxonomy ANZ code that we use in Australia. And if you look at these occupations, almost all of them are heavily dependent on the ability to work with technology and with data. And so a key point I want to draw out from today's presentation is that automation is creating a lot of change. It is not taking away the need for humans to do work, but in the future, these data and digital skills are likely to be increasingly important. Another key trend we see with automation that's already played out for quite some time is that because the technology can do the routine and rule-based tasks, the work that's left over for the human being to do is more complex and therefore requires higher levels of skills and higher levels of training. And so these data show from online job ads that are captured by federal government, which provide coverage of the entire Australian labour market, in the period from 2006 to 2019, there's been a declining demand for relatively low skilled workers, so people who've only completed secondary education or maybe a certificate one. Whereas the highest education category, the bachelor degrees and the postgraduate degrees, have experienced a strong increasing trend in recent years. And whilst interpersonal skills have shown the highest rate of growth, the other kind of skills that you've probably heard a lot about in the media over the past 5 or so years are STEM skills, which stands for science, technology, engineering, and math skills. But when we've done some work to understand how the changing composition of the Australian labour market, what that means in terms of the types of skills that are becoming more sought after, we've managed to get some insight into the types of STEM skills that are actually becoming most sought after. So we've got data from surveys carried out in the United States where they get human resources managers and other experts to describe what skills are needed in each of the occupations that they manage. So we've mapped that back to Australian occupations that are matching. And then we look at which occupations have experienced the most growth and what types of skills are needed in those occupations. And the key thing is that those traditional, highly skilled scientific types of roles, such as physics, are not where the growth has been. So there's actually declining demand for physics skills, no growth in demand for biology skills, and relatively small growth. And let's not forget our labour market's actually been growing over time in something fundamental like mathematics and even programming. Whereas the high growth has been in what we might call more generic digital skills. And that's scientific thinking. So the ability to define a problem, to maybe pose a hypothesis and collect some kind of evidence to determine what really is going on. The critical thinking is the next most important of the STEM skills that we analysed, and systems analysis. And you can see, yes, engineering and technology is important, but right after that, it's just interacting with computers. So I guess a key message I would like also to take away is that when we talk about digital skills being important, we're not talking about those really highly technical and almost esoteric skills. We're just talking about very generic skills around being able to think scientifically and critically and to work with the technology to solve problems. And to give you more insight into what we mean by digital skills, I'm just sharing insight into the categories of digital skills that are identified in key digital frameworks. So in Australia, as in many countries around the world, digital literacy is now being viewed as one of the fundamental literacies that it's needed to participate in society as well as in work. And so alongside arithmetic and reading and writing, Australia has developed a new digital literacy skills framework. And this describes the essential skills that are needed to work and live in a contemporary society such as Australia, where much of what we do, vital services and basic communication occurs online. So digital literacy skills, according to these essential skills, involve being able to use ICT to connect, to communicate, and to collaborate, and we're all doing that every day in our lives. But interestingly, we're not necessarily carrying those basic skills over to our work environments so well. It's being able to use digital technology and systems, so not necessarily design and develop them, but apply them, work with them, and use those technologies to be able to access, organise, present, and problem solve, present information. And finally, we need to know how to do these things whilst being aware of managing our digital identity and staying safe in that online environment. Australia doesn't yet have a digital competency framework for the workforce, but we're actually working on that at the moment. And one of the frameworks that we're considering for Australia is the one that was developed by the European Union. And you can see here too, the categories of digital skills that are seen to be needed in the workforce are around being able to use that technology to communicate and to collaborate. It's about having that basic information and data literacy, so understanding how to interpret numbers, that scientific and critical thinking, and then being able to create digital content such as website content, blog posts, social media, and also to use that technology to solve a problem for someone. And finally, that last issue about safety. So again, it's not necessarily that you need to know how to program, it's just being able to do the things we used to do face-to-face, but now with digital tools and potentially in a digital environment. I'm afraid this slide is not the best resolution, but hopefully I can just talk to this. So the World Economic Forum recently published their Future of Work survey again, and that identifies 10 emerging technologies that are expected to have a major impact on the way in which we work in the future. And these cover things like quantum technology, robotics, artificial intelligence. And so what we've been doing is searching for mentions of these technologies to see which of these technology skills employers are looking for when they advertise online for new workers. And you can see these job ads, or maybe it's not too obvious, these job ads go back to 2015 up to nearly the present day. And what we're looking at is the number of job ads that mention one or more of these technologies over time. And for most of these very complex and esoteric technologies, like quantum mechanics and position navigation and sensing, there's very low demand. So they are sought after, but generally in a very minority of occupational roles. They're very specialized skills, whereas the technology skills that are more commonly sought after in these emerging areas are cloud computing and data analytics technologies. So again, coming back to that idea that it's about being able to use the technology rather than program or design the technology that's becoming more important in the labour market. Now, this is all job ads that are captured by Adzuna Australia, and they're representative of the population of job opportunities in Australia. I thought it would be interesting to also hone in on the job ads that are being posted by aged care and residential care providers as a way of seeing what technologies these employers are in. And what is interesting here is that whereas previously across the labour market we see cloud computing and data analytics both showing quite high demand, when we look at aged care and residential care job ads, there's almost a declining trend in demand for cloud computing skills, and data analytics doesn't even show up as one of the highly sought after technology skills. So this shows evidence that in terms of uptake of digital technology and demand for digital technology skills, aged care and residential care sectors do seem to be lagging behind other sectors of the Australian labour market. And one of the things we have been hearing is that it's the lack of digital skills within these workforces that is making it harder for these employers to adopt new technologies and begin to make the most of those capabilities. And yet that's really unfortunate because, as we know, data and records are very important and a large part of what people do in aged care and residential care. Doing it manually is incredibly inefficient. Yet the potential with digital technology is not only to get these things online, but to integrate them so that we don't have so much duplication of record keeping, that we can save a lot of time in our reporting. And even more importantly, that we can begin to better predict and tailor what kind of support and services a client might need. So with more of these data analytics technology skills, there is potential to make a big difference in the quality and the efficiency of aged care and residential care in Australia. One of the problems that seems to be occurring, though, is that the training packages for community services don't seem to be delivering a lot of data and digital skills. So the Australian Industry Standards, they're a group that looks after many of the industry reference committees who provide advice on what content should be covered in the training packages. They carried out an analysis to see what digital skills were being delivered through these training packages. They took all the descriptions of the units of competencies that students had to complete and what performance indicators they were supposed to meet when they completed the course. So that really tells you what they're supposed to learn. And they searched for digital words in those performance indicators: data, technology, programming. And what we can see is that across all training packages, the word data did come up a lot, hundreds of times, and closely followed by records. And even not too far down the list, things like software and computers. So hundreds of these terms are being used in the training packages most generally. But if you focus in on the courses that are being delivered through the community services training packages, I don't know if you can see these numbers, but the count goes up to 8. So the number one digital skill that's being delivered through the community services training package, and which doesn't even come up that much, is reporting rather than data. And documents are number 2. So data comes up with only 3 mentions across what is more than 400 units of competency, and within those there are multiple performance indicators. And we only get 2 mentions of digital and computers. So I think it's clear that part of the problem here is that we aren't giving enough focus to digital and technology and data related skills through the training packages to make the sector really competitive in an era of digital transformation. So to wrap up, what can we do about this lack of digital skills? Well, a scan of international approaches to preparing workforces for digital transformation has revealed some key principles. One is that you need to start with a formal digital or industry transformation strategies. So why is it that greater use of technology is needed in this sector, and what value will it achieve? And then you need to form the connections, public, private and community partnerships, to ensure that the resources are available and the training that's being delivered and the technology that's being acquired is appropriate to meet the needs and the strategy of the sector. When building digital skills, the learning is that it first focuses on the basic and essential digital skills to participate in society, and then build on that with the more specific skills that are needed in a given work role. And finally, because technology is continuously developing, access to education and training also needs to be continuous. Unfortunately, the digitization of everything means that training and education can be accessed more cheaply and better integrated into people who are currently working. So there are massive online open courses that allow you access to material from universities around the world, near to free of charge. And we can see much more training being delivered online, the use of virtual reality tools. All that can assist us with making sure that constant upskilling in this digital skills domain is actually possible and can be done in a cost-effective manner. So in summary, key point is that the way in which we work is being disrupted, and this is different from what we've been seeing in the past 50 or so years, even 100 years. One of the big things that is happening is that workers need to be more skilled, more highly skilled, and the types of skills that they need more of in this digitally enabled work environment are interpersonal skills, because they're not easy to automate, and generic digital skills, not necessarily really high level, extremely technical skills. Fundamentally, what we need is the ability to use technology, to apply it rather than program it, to solve someone's problem, to gain insight, and to add value in a new way. And finally, that aged care, residential care, and disability care do seem to be behind the 8 ball in terms of building these digital trends and really making the most of digital technology. So I hope that is something that can be addressed into the future. Thank you very much for your time. And I'm sorry I won't be able to participate in the discussion, but very happy for you to reach out and contact me if there's anything you'd like to clarify.
Thank you, Claire. Great presentation, and I think really complimentary to the presentation by Anthony. We're just about to wrap up, and as a way of wrapping up and I guess getting to the key point of today's session is about what do we know about all of this and how it affects aged and community care, and broadly all types of care provided in the community, as Claire indicated, disability care. I'm just going to really quickly go through some of the issues for us, not only in the work that we do in the Community Care Smart Assistive Technology Collaborative, but I'm going to wear a couple of other hats. My day job, looking at business transformation in community sector, as working with my colleagues, Dr. George Mangelis and Rod Young, who are on board today in the Aged Care Industry Information Technology Council. And I guess my want, a need and a passion about how digitalisation can maybe improve quality, can assist with a more standard care delivery, more consumer engagement and control over services that are provided. And I guess the role that I've been honoured to play as a statewide digital champion in terms of health and aged care. So we do need, as Claire indicated, we need to improve digital literacy in the sector. We know that not only do we need to do this, that it's critically important to do it now. We know from the work that Anthony's detailed in the Australian Digital Index is that we can do more, and we need to do more, particularly with more marginalised groups. I'm honoured to be chair of the National Roundtable on aged and community care issues for forgotten Australians, and there are some of the most digitally disadvantaged groups that we see. So we need to do more, and we know that. So I'm just going to go through some current work and what that means for, I guess, a focus on digital literacy and improvement of digital maturity in the sector. Today's session is being hosted by the Community Care Smart Assistive Technology Collaborative. So if you haven't been involved in the collaborative, you will know that we've got a worldwide reach of over 2,000 individuals, services, families, service providers who are interested in the role that emergingly digitalisation will play for importantly improving the quality and consumer directedness of services. And we know from the work that we've done over the last 6 years in this collaborative is that more and more our workforce is required to have higher levels of digital skills. We're giving direct care workers smartphones. We're expecting them to interface with smart home technologies, and we're really providing very little in the way of digital upskilling. What we also do know is the leading and also surviving organisations are those that are strategically investing in digital transformation. We have showcased many of those in our collaborative through our webinars and other things, but it's obvious there's a digital divide in our sector, and those that are going to survive the massive reform agendas that we have are the ones that are clearly digitally transforming. But we all know that we have to actually do a lot more, and it's not only with clients and workers, it's about board members as well, and improving the governance around digital and technology governance. And we know that there's more investment needed, and certainly some of the work that we're doing through the Community Care Smart Assistive Technology Collaborative is about quantifying that investment and working with state and federal governments to see that in place. I also wanted to highlight the work of the Aged Care Industry Technology Council. We're about promoting analysis and evidence base and improving outcomes for the sector. I won't have time to go through all the research that we've currently undertaken, but here's a couple of the stuff that's available on the ACIITC website for you to freely access. Claire mentioned that we've spent considerable internal resources developing a technology roadmap for the sector. That's for the researchers involved in that. That worldwide is one of the most highly accessed research documents. We backed that up with a bit of a gap analysis in 2019. And looking at what the evidence was showing us was really impactful and quality improving technologies and innovation. We recently, hot through the period of COVID, completed a body of work for the Australian Government Department of Health looking at the capabilities and readiness of aged and community care sector to uptake technology. And more recently, we've worked with other entities like the Digital Health Cooperative Research Centre and some peak organisations to develop up, I guess, what is needed in terms of really true co-design of the sector. And we're completing a range of work for the Digital Health Agency, including a landmark study into the use of clinical software in residential aged care. So what do we know from all these endeavours? Really that we need some new workforce service models to address the greater uptake of technologies. But we also need that we know that the evidence is showing us that these technologies can actually really improve the quality. Our recent Care IT report found also that the majority of organisations surveyed, over 75%, did not assess potential workforces for their digital literacy as part of their recruitment or selection process. And only 17.4% indicated that they use any measure of digital literacy in recruitment of workers. This is at the same time we give those very workers smartphones, smart home technology devices, etc., and we expect them to use them. And we also know that from that survey that 57.4% of providers actually do believe that digital literacy training should be mandatory, but it's not. So we do know that organisations regularly provide generic training, but very few of them are providing specific training, particularly around cyber security and risks. And we found that only less than 22.9% were providing any dedicated training around cyber risk. We know also that we're an industry being under attack, some playing out in the media if you're a publicly listed company, others in their workplaces and affecting both clients and staff. We know that of concern, 38.5% of organisations didn't provide any training or support in these areas. And we know that that's not going to be a feasible situation going further. So we do know from a range of projects that we're currently undertaking that really the highlight is that we can actually do more here. I'm just going to mention a couple of projects that we're undertaking at the moment, that it is essential to consider a digitally literate workforce at all levels. The council is currently in partnerships with University of Queensland and PwC in undertaking a landmark study of work to introduce the $200 million initiative as part of the 2021-2022 federal budget, along with the Royal Commission submission, Royal Commission recommendation around the introduction of star ratings for residential aged care. We know that the only way that most residential care providers are going to be surviving in this is to ensure that they get recording of quality, for one, at closest to the point of care and service delivery. We know from our Care IT report that most people, over 40% of service providers are still manually uploading their QI, when we know that there's a range of technologies that can automatically do that at the point of the service delivery or at the point of care. We know that the reform agenda also provides a huge emphasis on the need for digitalisation of the workforce. And you can download all these reports that we've currently published freely on the website for the Aged Care Industry Technology Council. We also know that there's an important role being played out here in digital championing and digital mentoring. And I'll call out to the mentor program that the Aged Care Industry Technology Council has invested in over the last couple of years, and also the states and territories that have invested in digital champion programs I think that is making an impact, and certainly significantly an opportunity to assist people who may be new to the sector, or indeed in some cases been in the sector for a long time but just want to improve their digital literacy. So where do we go from here? I'd like to just bring your attention to a number of available resources, both from this Community Care Smart Assistive Technology Collaborative. Digital literacy and digital inclusion has been a real focus of our work from the beginning of the collaborative. The Aged Care Industry Technology Council provides a number of national roundtables, and I'd encourage everyone on the line to put your name and email address forward at our website to be involved in some of those. We have roundtables looking at the particularly specific technology issues, but we also have roundtables looking at workforce requirements, standardisation and service model requirements. And importantly, we're just about to introduce a new roundtable that's looking at the value propositions and value considerations, along with those important issues of return on investment in a marketplace that's fiscally restrained and doesn't have a lot of extra dollars to invest in this agenda. And really the subject of today is our Be Connected national program and the online resources that are available through Be Connect. I'd encourage everyone to go on to the website and take note of the website that we've published here. Be Connected is an Australian-wide initiative, as Anthony highlighted earlier in his presentation, really empowering all Australians of whatever age, whatever job you do, wherever you live, to be more engaged with the digital world. Their online resources are really excellent resources for community care providers, and really it's about getting really to the grassroots of digital inclusion and digital literacy. I'm going to take questions now, and I know that there's questions in the panel already. As we're going to ask those questions, Georgie's going to put up the evaluation slide, where we also hope that while you're listening to the questions being answered, that you will provide your input into today's session. So Anthony, it's you and I with the questions, and Claire has indicated she will take any questions on notice. I've got a number of questions coming through the Community Care Smart Assistive Technology website. So I'm going to start with those, and then I'm going to go to the questions in the chat pane. So that'll give people a bit of a time that are actually live on today's presentation to add any final questions. So I've got a question here from Mal, or a comment, I think, Anthony. It's one, I think, born out of frustration. So Mal indicates the digital first strategies of all governments are great strategies for those governments, but not great strategies for the people who are trying to use it. How can you influence entities like MyGov to be more user-friendly and digitally inclusive? Mel indicates it's taken her 4 weeks to even find where her digital health record was, and she still hasn't been able to download it. Over to you, Anthony.
That's such a hospital pass, as they say in the football game. It's such a big deal. I'm constantly myself thinking about, when I'm engaging in these kind of services and platforms and accounts, how my my grandmother would have dealt with it when she was alive. How, you know, a wide range of people would actually cope navigating the difficulties of exactly those things. It's a whole range of things. It's not just where the accounts sit. It's about having an account, what that means, how you keep track of passwords, of usernames, how you authenticate process, you know, the two-step authentication process that you always have to go through. There's such a wide range of issues. We've had these conversations. I've had these conversations with Department of Social Services, for example, who love to take advice and are open to hearing about the difficulties, but don't have any solutions. They maintain that they try to simplify everything as much as possible. I think it's a huge challenge because in particular, if those services suddenly change, and they often do in terms of making them simpler or optimizing them, that throws everyone out in exactly the same way as the difficulties of accessing them in the first place. Once you learn how to use a system, if it changes, you've got to learn another system or another set of processes. It's an ongoing battle. It's part of the reason why Be Connected is focused on that a lot, and a number of other organizations work, specifically around trying to improve skills for government services. But this is a global situation. It's not something that's going to go away, digital first, and in particular, digital government. It's massive cost saving, but it also works towards their own digital transformation strategies and plays into those digital transformation strategies. Our goal is really, or my goal is really, to make sure that digital inclusion is always upfront in all of the design processes, that there's community participation in design processes and proper co-design, and that doesn't always happen. In fact, I would say it rarely happens.
Thanks, Anthony. Look, I couldn't agree with you more. The council invested in a framework of co-design for our digital future, in line with your colleagues from Swinburne University Future Self Living Lab design unit, and we see perhaps that is the area where we can achieve extremely advances in the reform agenda if there's actually a level of co-design in there. Also reflecting on your comments with students, one of the resources that I often recommend that they have a look at is the movie I, Daniel Blake, a UK film that got some awards, and it's all about digital inclusion and the effects of that on people's lives when you don't think through government policies well. So thanks for that. We've got a really excellent question from Elizabeth in the chat pane. Anthony, I want to get to that. It really talks, I think, directly to some of the dilemmas that we have. So Elizabeth writes, and thanks Elizabeth for this question. The map of users was fascinating in your presentation, Anthony. It was interesting to see the line of dots across the eastern coast. Do you have an analysis of the user demographics and compare these to the population health characteristics in each location? What I'm interested in is to learn whether the more privileged folks are overrepresented in your cohort. Did this program reduce or increase the digital divide across subgroups in the targeted age groups and participants? Great question, isn't it?
It is a fantastic question, and I know Elizabeth well, so I'm happy to talk with her after at some point about this at length. But yes, look, the analysis that we have showed that we had a kind of representative, we had representation in terms of socioeconomic levels, so levels of wealth and income. However, we found that the program, people participating in the program were slightly oversubscribed by people with higher level of education. So this was university degrees and certificates and some form of higher education. So, but otherwise we had fairly representative demographics right across the board. So that was in terms of cold background, it was in terms of Indigenous connection, and there are some really great Indigenous focused parts of Be Connected program. And I think that representativeness overall reflects the way that all of those dots on that map are about ensuring that, and the work that the Good Things Foundation does is about ensuring that in all parts of populated Australia, there are organisations engaging with local people in their communities and in ways that are relevant to them. So communities that are heavily cold focused have very much a cold focus to their Be Connected program, and often work in multiple languages as well. So I think that's an interesting outcome of the design of the project, of the program. Whether we see that it increases or reduces the digital divide across those groups is a longer term scenario, and it's something that I'd love to be able to track over time. At this stage, my feeling is that this is about program design, so it's really about getting to people in the places where there is need. And I think this is like continuing with Claire's discussion and your own, Anne. This is about also addressing people in their workplaces. And I've got another project that has just begun with colleagues at QUT and other universities that's looking at low socioeconomic family circumstances as well. And so we're looking at 5 communities across Australia in terms of the way that digital inclusion and exclusion works in terms of low socioeconomic family contexts and their community contexts as well. So it's very much about, looking at what's happening at the local levels and how that's reproduced and how we can intervene in that. And I do think that Be Connected it is one of the best interventions in terms of making a difference at that level as well.
Thanks, Anthony. A couple of questions around forced innovation through COVID. We've seen in our sectors, a huge uptake of technology, both from a consumer perspective and the necessity to keep people connected in some way when direct services perhaps may not have been able to be delivered. But I've got a range of questions which I'll try to sort of synthesize a bit. Do you believe that the digital improvement that we may have seen through the forced innovation, do you believe it's sustainable?
Yeah, it's a good question. There has been some really good statistics to show increase in digital technology use. Look, I think that we do need to take this with a grain of salt and really understand circumstances. I don't have the research so far, but I can only go on what I've seen and observed, and the conversations that I've had, and really thinking about what's happening at the ground level. So, for instance, in the widespread rollout of telehealth, for example, we saw that sudden shift to home-based telehealth, both on the part of the clinicians or doctors or psychologists, but also in terms of clients and patients. And there were there's tons of research unfolding in this space, so we'll find out more over the next year or so, I think, about how this has gone. But from what I've seen, it's been really interesting to note the problems and the tensions and the difficulties in the way that this has worked in that context in terms of telehealth. I've spoken to clinicians who talk about the way that, yes, it's all well and good to set up consultations through Teams or Zoom or any other particular teleconference platform, but in the end, what happens is that clients and patients end up just getting on the phone, and it ends up being a phone consultation. And we know that we know all of the limitations that come with not making that physical connection, and not being able to assess. So for instance, with one psychologist that I was talking to, they had the experience of working with a client who sounded really great on the phone, but insisted that they do a teleconference connection at some point. And when they saw the state of their house, the state of their physical demeanor and well-being, it was really disconnected to their phone voice. And that is such an important part of the context for delivering that kind of service. And that's just one example. I think we're yet to see, how significantly or how we bounce back to physical services and face-to-face services, and to what extent we can actually say that this is an improvement in terms of digital inclusion and digital connection and digital skills use, because I'm not totally convinced myself.
Thanks, Anthony. I've got a couple of questions from a known digital inclusion champion to us, Lisa. I'll just sort of amalgamate these a bit. How does BConnect keep ahead of the tech changes and stay relevant? Might be a first one. And then have you got any comments about the intuitive usability difference between iPads, iPhone users and other branded tablets / smartphones? Any comments? One's, I guess, at a program level and one's at a technology level.
Yeah, I'll start with the technology level question. I don't have a lot on this, but I do know that that phone use, smartphone and tablet use are the main focus and the main starting point for a lot of participants in who are seeking to build their digital skills. And it seems to be, because there's so much that you can do that is intuitive in terms of iPhones and iPads, it really is a fantastic starting point. And it's not too difficult to move to then make that step between, say, an iPad use and email and other services, and then using a browser and then using online services and so on. In terms of, I think there's an element to that question around the ecosystem, say, for example, that that Apple sets up as opposed to Android systems, etc. And that's always an issue. It's an issue of confusion for a lot of people. But one thing that I will mention here is that we do know that that phone-only internet users are the other category that we have of least digitally connected users. So they're affected in all other ways in terms of their ability to get online, to use digital technologies in their life. So that phone-only scenario is an important part of the puzzle, I think, that we need to think about. So it's both an in point and a point to leverage and to work off, but it's also a limiting factor. In terms of the other question is a good one. How do programs like Be Connected keep up? In particular, in terms of technology changes, how do they stay relevant? Look, to me, it's an open question. I don't have an answer to that. It's certainly one of the recommendations that we made to government at the time, earlier this year and last year, that the success of the program, or of any program in terms of digital inclusion and digital skills building, is completely contingent on staying relevant. And that's about staying relevant to people and to people's needs and listening to them and understanding them, but also in terms of the technology changes. Now, I say that those are two different things, and they're really important things. So we made a big effort to emphasize that group of participants that I mentioned that you know, have some digital skills, that have for a long time been digitally connected, but that the Department of Social Services don't necessarily see as the target population. But we just wanted to emphasize that they are really crucial in terms of those people who can very quickly and very easily slip off the radar in terms of all of a sudden just being digitally disconnected because of the pace of technology change as much as anything else. But also in terms of their life circumstances and in terms of their confidence levels and so on. So I think that's a really important part of it. But yes, there needs to be ongoing investment. And so far, the government has been great when it comes to investing in older Australians' digital inclusion, but not elsewhere in the population. And to me, that's a real gap.
Thanks, Anthony. I'm going to go to a question from Rod Young. Anthony, you might have heard of Rod. We think Rod's a statesman in our industry. He's got a very long and respected career in advocating for digitalisation of the sector, and indeed established the Aged Care Industry Technology Council. So Rod's doing a lot of work at a number of levels and asks the question of how to include people with very low incomes or fixed incomes, such as pensions, who struggle with the ongoing expense of being connected. Are there any solutions to that question, Anthony?
There absolutely should be. And thanks for the question, Rod. And yeah, absolutely love your work in this space. Look, it's been an ongoing part of the partnerships that my colleagues have had and I've had with Telstra, for example. It's something that has always been there in the background in terms of that universal service obligation that the government used to have or impose on Telstra when it was a public entity, and should really be an ongoing. Look, I think the universal service obligation needs to be transformed into the new era in some way, and that's not just me saying that, but it's a huge part of the problem, and that aspect of competition around digital services and digital service provision, particularly telecommunications and internet service provision, you know, is a great driver of inequality in a lot of ways, and it shouldn't be, absolutely shouldn't be. So that's a kind of big structural kind of answer to that question. But at the ground level, I'm completely focused on this question in our project with low socioeconomic families and digital inclusion over the next few years. And we really want to figure out how local services and service providers, how local government and state governments and all of the programs that are in some way involved in digital inclusion can better serve low-income families, because I think if we can do that, then we can address some of those longer-term issues. We can address those issues around expense. You know, we're talking about families that have to ration data use. So a lot of the families that we talk to, for example, you know, the parents absolutely have to switch off their modem at a certain time so that they don't overuse, or so that their kids don't overuse data late at night, and that they run out of their data allocation over the month. People who really do rely on libraries and other places where there are public Wi-Fi facilities, but those are even harder to find these days. So there's a whole heap of issues here that I hope we can address in some way, but it is part, at least the important thing is that we've built it into the Australian Digital Inclusion Index. That question of access and affordability is a part of that index. And that's a really important way of driving that agenda forward.
Thanks, Anthony. We've probably got time for just one more question, and this question's from Cowan. You used 3 terms in your reporting. Those terms were engaging, accomplished, and evolving. And she indicates that this created a positive image, but how did you measure? What were the measures that you came up with to classify people in each of those 3 categories?
Yeah, it's a very good question. It was a combination of measures. Now I'll just quickly go back to, so it was a combination. So essentially it was a form of statistical analysis, not an easy one to end on, form of statistical analysis that helps to group participants in a program. It's called a latent class analysis. So it helps us to identify groups that aren't naturally, say demographically separated, for example, but are grouped together in terms of a number of factors. So we looked at confidence, we looked at skills, we looked at attitudes to digital technologies, and we looked at online activities as well. And we looked at outcomes in terms of where we saw change in the program for participants. So it's a very, I mean, we have a whole bunch of research papers that we're about to publish around this, and understanding the nature of these differences in terms of these classes. But what I want to say is that it doesn't fall along our traditional lines that we tend to distinguish people and groups in terms of digital inclusion issues. And this is where that work or our work is builds on and provides some nuance to the Digital Inclusion Index, for example, that will take those broad indicators like age groups. So in bringing all of those additional factors together, we could assess the differences in terms of, essentially, if you think about it in terms of people's interests, needs, their background, and the kind of involvement that they had in the program. That's how we sort of divided those groups. So we called them emerging learners, and emerging learners because these were people that were making a huge effort. So they were involved in the program, but their skills were emerging. Their actual skill change happened quicker. So they went from a lower base and ended up at a higher base. And then we called the other groups accomplished, in the sense that there wasn't really any change in their involvement in the program, but they were already, to some extent, digitally competent and capable. And then it's that other group that is the big kind of unknown, and it's the group that we really want to dig into, as I keep saying, and find out more about. Those who are actually vulnerable to falling off the grid in terms of digital technology use, who have low confidence, and also only show targeted change in the way that they improve in terms of their digital skills.
Thanks, Anthony. Cowan says she apologises for asking a statistical analysis question at the end of the question time, and she'll be approaching you shortly to be her supervisor for her PhD. Awesome.
That sounds fantastic.
Excellent. That brings us to the end of today's session. Remind everyone on their screen is the evaluation survey. We really do take evaluation very focused in our camp, and we do love to hear your feedback about how we can improve on things. So please fill out that survey if you haven't already, and we know in the background many of you have, so thank you for that. By way of wrapping up today, I'd just like to particularly thank our two speakers today, Professor Anthony McCosker and Dr. Claire Mason. Great presentations that really covered a diverse range of topics that are of interest to community care providers. So thank you again for your involvement. I'd like to thank everyone online today. We know how busy it is out there in community care land, and dealing with lockdowns, dealing with reform agendas, dealing with everything else that you have to do in a day. So thanks for joining us today. Just a reminder that we will be posting this on our collaborative site and sharing it with BConnect. I'd like to acknowledge the assistance that we've had with BConnected to undertake today's webinar, and look forward to you accessing their important resources. I'd also like to thank the team from the Community Care Smart Assistive Technology Collaborative who've been in the background, and in particular Georgia Gould and Cody Kramer. So thanks everyone for your involvement today. Just in case you want to be in contact with us, our contacts will be on the screen as we finish today's presentation. Thanks everyone for attending.